we need to think about not the patient with one condition, but the person with multiple needs. And that's what we put a lot behind the word ecosystem.
Here we've just talked about how to get people involved in the program. Then my last question is, how do you get them to stay in it? How do you get them to go through it, through to the point where they've actually changed their habits and are taking their meds and are carrying out the various changes that the healthcare community has suggested that they do?
I think our belief, at least in the Zuroso group, how we're approaching it is kind of looking at what others have been doing also in other industries. What are the codes that have made this successful? You look at Booking.com or Zalando, right? They created ultimately that logical front door where people think, okay, I need this kind of support, I'm going to go there. I'm not going to go on Google, I'm going to go straight there. So I need a hotel or airlines or Booking.com, right? I think we need to build this in healthcare because it's right now still a very siloed, confusing sometimes experience. And I think one of the key driver of engagement is how do we make things simpler? I think digital health has so far had one big issue, which we identify quickly all of these things that we can do to help someone with a certain condition. But first thing is we add work to the person. We're not taking work out. So if you take the case of diabetes, it is already extremely burdensome and complicated to manage your diabetes. And so now you have connected blood glucose meters, you have apps, you have doctors that want to see your data. All of this on paper makes tons of sense, but in practice, that's another app to download, another account to create, another thing to figure out, a PDF report to send. It's all more work for the patients. And so they're unlikely to stay if you add work to them. And I think that we have to adopt the principle of how do we make this simpler? It needs to be seamless. It needs to be, how you buy online. It's really, everything is made so it's simpler, right? Your card is in there. It's one-click purchase. You don't have to re-put your address. You don't have to create another account. We make things simpler. That's the principle of the online business. I think that's what we have to do in healthcare as well. And we recently announced a collaboration with Roche in Europe, especially on that topic. Right. Our goal as two parties is not to create another diabetes program because they're already there and they're fantastic. To say, how do we work together to make things easier for people to use this so that their data goes to their doctor online and they don't have to think about it, so that you can renew your script online without having to go every 3 months, even if you've been 15 years on insulin, to the doctor to get a piece of paper to go to a physical pharmacy where all of this can be managed, most of it online. So I think that's a big driver of engagement. The second one, at least in our view, is it comes back to a point I made earlier. Like we need to think about not the patient with one condition, but the person with multiple needs. And that's what we put a lot behind the word ecosystem, at least in our strategy at the Zuroso group, is how do we surround a person with all the different helps that they might need, and how we understand in a more personalized way how we can help beyond just helping you as a diabetic, but we can also help you manage other things you have. You might have allergies during pollen season, right? And we need to help you on this part as well. It's nothing to do with your diabetes, but you're also going to need that help. And maybe during pollen season, you use your insulin worse because you're suffering from allergies and you're thinking about something else. So how do we help you on that? How do we help you on mental health? There's a really interesting DIGA that's just been approved in Germany last week, which is really focused on diabetes-related depression. It's very specific, but unfortunately, many people suffer from this as a consequence of their diabetes. And if you don't help them there, you're not actually truly help them overall. So I think if we can use digital health to also bring these solutions around the person and recognize them as a person with multiple needs, not as a patient with one condition you're trying to fix, it can also help that engagement because you're truly there to support beyond one thing that doesn't define you as a person.